Chad Robbins here with Robbins Plastic Surgery. Thanks for tuning in. We're here to answer some more questions, and the question we're asked today comes from a particular patient who lost a lot of weight. She has hanging skin on her arms, on her thighs, and on her abdomen, and also has some concerns about droopy breasts. When patients come with complaints of multiple areas, I ask them to prioritize what bothers you most to least. Invariably, hanging skin on the abdomen is either number 1 or number 2. Paniculectomy is an operation that describes removal of the skin and fat that hangs down just in the central portion of the belly. Insurance will sometimes pay for people to have a paniculectomy, and the reason they do so is because these patients have recurrent rashes, cellulitis, and abscesses in the folds between their skin there. In order to qualify, we have to make an argument for medical necessity. That's the term that insurance companies and that we physicians use. In order to meet criteria for medical necessity, not only do you have to have these symptoms of rashes, cellulitis, and abscesses in the folds, but you also have to have tried non-surgical treatments for a period of time and show that they've not been very effective. Once we make the argument on behalf of patients who have these symptoms, they ask us to substantiate that document with photographs. And so they're either approved or denied based on the appearance of their pannus. If the pannus or hanging skin doesn't hang down over the genitalia to the thighs or doesn't obscure the genitalia, oftentimes these folks will be denied. Nonetheless, there are other options and other treatments we do to address the hanging skin in this area. For example, we do tummy tucks, and there are a couple of different types that we use. A horizontal scar, where the scar is located hip to hip, just above the pubic area. We do what's called a fleur-de-lis abdominoplasty. That's a vertical scar and a horizontal scar. And we do this to address hanging skin and excess fat above the belly button. We also do something called a body lift, which is a scar that goes all the way around the waist, right to the top of the buttock. In that particular operation, where we're pulling the tummy skin down and tightening those muscles, we're lifting the skin and fat on the hips and on the buttock area to accentuate and improve the appearance of those. It's a fantastic operation, and oftentimes when people have lost 50 pounds or more, that's what we recommend. Unfortunately though, the abdominoplasty and the body lift are not covered by insurance.